It's a very impressive attachment you got there.
You like that?
A lot of different
I found
angles.
it in a garbage can.
I'm sure you did.
This is all pretty janky setup, but it works, doesn't it?
Yeah, nobody else sees it.
What do you guys think out there in Viewerland? You enjoying this podcast?
They're not going to say anything.
They're not going to respond?
Follow, subscribe.
Follow and subscribe, please.
Smash a like button.
Smash it.
Dear girl, I am a doctor.
These go to 11.
Wait a minute, Doc. Are you telling me that you built a time machine?
Did we just become best friends? Yep!
The skeleton ran out of shampoo in the shower.
1.21 gigawatts!
This is a house of learned doctors. You're not a doctor.
Here, we got some. Welcome to the Spinal Tap,
Episode
Richie.
3.
Cheers.
Nice to see you guys.
Episode 3. We got some. We got some cold brew.
Thank you for getting
From People's Organic, which I was talking to Dr. Mitch about. When are sponsors going to start just giving us money?
No, we're actually
Any minute
turning.
now.
We're turning them down.
This. Yeah, we are just
Why hasn't that
push 'em out
occurred
the
yet?
broom.
Why am I still working? We have no funds,
So if
but we'll sponsor you.
It's a write-off. Talk to Bill.
Yeah, I mean, we should. We do need some sponsors.
I mean,
There's
local
a-
companies.
Yeah,
People's Organic
is a great one.
They're great. That's where I get the majority of my coffee.
You hear that out there? Yeah.
Anyways,
Sounds good.
here we are. Here we are.
Episode
So
3.
3.
It is May 15th.
That was a crispy high five.
What's going on?
The patient was like, "Oh, the year's halfway over," and I
Jeez,
sent
man.
them out of the clinic.
Good.
Said, "Get out."
God. I just woke up. Come on.
Yeah. So, gave your sister-in-law her first
Yeah,
tune-up.
we do our little Chiro. What do we even call it? We have
Just
a
like
different
a-
clinician come in on Saturday, and she tunes up her kids, and she,
Well, we could probably say her name. Give her a little shout-out.
Dr. G,
Dr. Carrie Getzmeyer.
Follow that. Smash it.
Lake Point.
She's great. But anyway, she takes care of our children.
That's
Children.
nice.
Sometimes nice to have people take care of your people.
Right.
Yeah.
Or
Just have a
community.
just a separate eye.
Right.
You know?
Yeah, you can always imagine there's some sort of bias or, yeah, even you guys are adjusting.
Tell my kids
maybe
to
miss
suck it
something.
up.
Yeah.
Yeah.
You don't need
Walk
an
it
adjustment.
off.
Throw
Yeah.
some dirt
Or
on
you
it.
get in a fight with your wife, which
Right.
I never get in a fight ever.
Zero fights.
Me
Ever.
neither. I never had
But
one.
if I've heard from other people,
I heard they're bad.
you know, you don't want to,
No.
you know. Well, should we get into
Yeah,
it?
what
or-
are we? Yeah, I'm actually. We talked about this earlier in the week, and I was really excited about it because we've been throwing the idea around for a little bit of this topic, and it's really exciting to me. One, because I want to hear what you guys think about it, but two, because I might have some things to say as like the patient point of view, because I've seen a lot of chiropractors, but yeah, I could
Richie's just been.
shroud that.
This
in.
is the moment he's been
just like
waiting for.
itching.
Acting like he likes us.
I'm just
and
gonna
he's
shut
gonna
your
put
camera.
us in the grave.
Yeah, that's right.
It's
Right.
like,
Here's what
you
I have
guys
to
are.
think.
I've been holding this in for 5 years. Yeah, but what are we going to talk about?
Why chiropractors suck.
Gosh,
Not.
not. Yeah.
I'm having a good time. Not.
No, we kind of thought about, what kind of, what would be the description of that take?
Why chiropractors are full of crap.
Yeah.
Why why they're not legit.
Yeah.
Why insert negative connotation,
Yeah.
right? Basically, because there's a lot of them, unfortunately.
Well, yeah, it was last week while I was taking care of business at the clinic. It was fine.
Jury duty.
Jury duty. It was funny. On the same day, I had a gal come in who's, I think, family member. I'm not exactly sure, but they are going through medical school, ER type of residency right now. And she's like, I made a promise not to get my neck adjusted.
Is this my?
Oh, yeah.
Yeah, I
Yeah,
told
she
you
came
about
in.
her.
Yeah.
Okay.
Yeah. So that happened. Dr. Zach can talk about that, but it was interesting having a conversation with her because she was like totally open to it, but she's like, I made a promise
Yeah.
because my family member is like, do not. They always come in here. People getting strokes from chiropractic
And
adjustments.
Granted, he's like he works in like the ER.
Right. Where
So he's
all the
he
strokes
sees-
come in.
He's probably like never go on a boat, never jump on a trampoline.
Yeah.
Like
Just don't go outside in general.
yes.
Yeah, if you don't want to do something, don't jump on a trampoline because you're guaranteed
are
not
really-
to have a good time.
Yeah.
So I had that experience, and then I had kind of juxtaposed to that. It was on the same day. I
Is
had
this your word of the day?
no.
Like, do you have a little
do you know?
calendar?
Do you know
I can't wait for our podcast.
I learned juxtapose in 6th grade. We went through like this whole alphabet book, and juxtapose was one of them.
It's a fun
never,
word.
yeah,
I use it a lot too, actually. I think incorrectly most of the time, but
yeah. It was something about an animal taking a pose, juxtapose next to something like a rhino next to a mouse.
Oh, yeah.
Juxtapose these positions to show
Sure.
their difference.
yeah,
Or
you're
their,
a good teacher.
Mrs. Larson's class.
Shout out.
Anyways,
Smash that
and-
like button.
Yeah, she's not watching. She probably doesn't like chiropractors. But the next person I saw was a guy who I haven't seen for a while. I just asked him how he was doing. He's like, yeah, it's a little bummer. My buddy died while he was getting knee surgery. And I was like, oh, interesting.
Jeez.
I wonder what that stat is. You know, so that was, and we were talking about our podcast, and I was like, you know what? Let's talk about
Yeah.
why chiropractors suck and kind of debunk or just like list our reasons of like why we're effective and why we do what we do. Because I think we're obviously an important part of the healing community, and risks and rewards, man. That's what it's all about.
And there's like an unfortunate amount of shade thrown your way too around like
We're a very easy target
you are an easy target.
because I
Like
think we have some sucky people in our industry that take
Right.
advantage of stuff
Right.
that, you know, can't be studied, but they know anecdotally it helps. And,
Yeah.
you know, there's a lot of justifications for what you do in a profession. So I think as an industry, like we need to like step back and say like, okay, what's appropriate? And I think the majority of chiropractors out there don't take advantage of it, but there's that set few that do. I was pointing past you.
there's somebody in the other
Yeah.
room.
One of the interns here?
So yeah, why
Yeah.
do chiropractors suck?
Man, are you asking me?
Yeah.
You know what?
What have you heard?
One of the things that comes to mind is, and I've been sucked into it before, in past treatments, is like it's almost you could even like akin it to a Ponzi scheme almost, where you're like, let's get this patient in and just milk them for as much money as we can.
And that sucks.
And that sucks for me and everybody out there listening that has had that experience before. And it's, I think that's one of the reasons that people have this negative connotation around it, because it's like, oh, yeah, I'm going to go and they're going to want to see me twice a week for the next 5 years. And I'm going to just keep going. That's crap. And that's not true. And I can speak because I've seen a lot of good ones, and you two sitting across from me are two of those that's like, no, like let's get you fixed and then maintain if we need to. And yeah, so that's one thing.
I have something to say about that.
Yeah.
And he probably has similar thoughts, but we have patients who come in all the time with that thought. And I usually say, well, what's your goal? Because some people might need to come in twice a week for 5 years, depending on what
Totally.
they're presenting with, or
Yeah.
they have a chronic condition that's like, we need to stay on top of this. And if you don't want to do stuff on your own, like we're a good way to access, you know, some movement and get you feeling better. And if that's the expectation, then,
Yeah.
you know, let's
That's a
work on
different
it.
timeline. Yeah, and that's the whole conversation of having that when we meet with people. Yeah, what are your goals? Oh, I want to train for a marathon.
All right.
Okay.
Don't do it.
I'm probably going to see you for a while.
Yeah. It's like if you were training for a marathon, you're not going to run every day for a month
Right.
and be like, oh, I'm good.
Yeah.
No, it's like time and consistency. So to that point, and I tell people too, like, I love all my patients, but I don't want to see you 3 times a week for the rest of your life.
It's kind of boring.
Yeah.
Yeah. And there's just, you don't have as much
Run
stuff
out
to
of
work
thing
on.
to
And if
talk
you're not
about.
improving, then there's something else going on. And I think we talked about. Did we talk about that on a podcast? Like our
go on.
like our expectations as like our clinical brains as it is right now. Like we both come from clinics that had care plans that were appropriate per like what was presenting. But there's some clinics out there that it's like, you know, they're just doing adjustments and they're telling people to come in 3 times a month or 3 times a week for, you know, at least 3 months. And it's just like boom, 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 boom. Can we all hear that background
Yeah.
noise?
Hey, out there.
Excuse me.
Hey, there's a
Trying to do
podcast.
something important in here.
Why is the door closed?
Anyway,
Yeah.
so
Well, no, that's interesting.
I do
Yeah.
have some personal gripes with some clinicians out there, it's like they come from a good place. Like their goal is to help people feel better. And I think I definitely, my enthusiasm sometimes gets mistaken for like, yeah, I want you in here. Yeah, pushy.
Right.
And I usually have a conversation like, don't misconstrue
Yeah.
You're my enthusiasm.
Yeah, because you're not pushy.
It's just like, oh, we've seen this before. Let's get you in.
Yeah.
Yeah, this is what it's going to take.
Yeah.
Like, I want to see you X amount of times for the next couple weeks.
Right.
And then,
I mean, he and I, we had a discussion when we bought this practice. And we're like, I was burnt out with some of the treatment plans that we were doing, but we were doing a different type of chiropractic care where I was. And he had some similar stuff like with decompression therapy and spinal traction. Like that takes time and effort and frequency. So that's all appropriate. But for us, I was like, dude, I don't want to recommend anyone more than a month of care right now. I'm so over like,
Sure.
well, you got to come in 3 times a week for 3 months and blah, blah, blah. And it's just like, I know what I can do. I feel very confident in a month. Like if we don't get you feeling better, 6 to 12 visits is kind of like my goalpost. Like 8 is a sweet spot because it's twice a week for 4 weeks. Like if we do everything we can within that time frame, just like working out too.
Right.
Like you're going to feel better. And if you're not, there's something else going on. And let's either talk, move you on, or,
and that was our starting point for most people. Like that wasn't the end of their care, of course, but it was kind of a starting point.
Phase 1.
We've seen providers that have undertreated. We won't say, but we've seen people that have undertreated, and it's like, well, that's equally a disservice.
Sure.
Almost more.
Opinion alert.
Yes.
Hard take is,
Zoom in.
underserving is almost more detrimental than overcaring for.
Could I ask a question about
Yeah.
your opinion? What would be the reasoning for underserving? Like unintentional underserving, or
Probably same thing, coming from a good place. I mean, it always kind of starts coming from a good place. I would say underserving, because you don't want to come off as like a crappy chiropractor, right? That's why chiropractors suck, is because so many people are commonly here like, oh man, once you go once, you have to go forever.
Yeah.
Which we can get into that.
I'm into that.
But probably the same reason. People underserved because the providers, sense that, and they may have their own ingrained opinions about that.
You and Dr. Carey were talking about that this weekend.
Were we?
Like your bias, like
Our
going
bias.
to treatment plans.
Oh,
like,
treatment plans. Yeah,
I
we were
don't know.
bias.
Like this person needs a lot of care, but I don't want to say that.
Yeah.
Because I have a problem with it.
Yeah.
Where like it's money, it's time, it's
Yeah.
family commitment, like whatever.
Yeah,
it is.
we were talking about the money side of it, which is true. It's like, well, yeah, stuff costs money.
Right.
Like
It's a tricky profession because there's not many doctors that are having to deal
with the money.
with the money end of it,
Right.
right? That's
And that's
taken
our
care
fault
of in the
too.
back end. right?
Like we could have structures in our clinic where like,
Sure.
here's the plan. X person will talk to you about the cost. Bye.
Sure, but
there's
you're
some
an entrepreneurial startup small business, so you can't really afford all those extra
Right.
infrastructure builds. So
Yeah. So that's probably that's my thoughts, my opinions on that. So
Yeah, and there's some chiros with like their ego is like, well, if I can't get you better in 2 or 3 visits, then if
Yeah.
anyone else recommends more than that, they're crap. And it's like,
that's-
no,
Well,
it's not true.
and we hear, can we talk about the school?
Yeah,
Okay.
Northwestern.
So-
I mean, like so here, preface this. We work with Northwestern, like our school that we went to. We take interns and we help them learn in their last year of clinic. Like Northwestern does a good job, but we have opinions, and that's
We have
okay.
opinions.
that's why this
Yeah,
podcast
and-
exists.
Go for it.
Well, to your point, you're saying a lot of people think that they can get somebody better in 2 visits, which is like, no, that's
it
not
shouldn't
correct.
be a personal
And
challenge, right?
I would say
We
like,
can move people on we can help them feel better.
and this might be generalization, but a lot of times if they feel like they can do that, they're kind of they feel like they're coming from a place of evidence based, which is actually not true. Because if you look at the evidence for like acute care, like minimum is like 4 weeks, right? Like
Like
2 to 3
standard-
times,
yeah,
2 to
standard
3 times a
procedure.
week for like 4 weeks is like if
Sure.
a person comes in with like acute pain or whatever it is,
Yeah.
like that is actually what the evidence supports. Man, but if you can get somebody better in 2 visits, cool,
Rock on.
it's great. like then like change your game plan, right? So not getting fixed on like,
Yeah.
being adaptable too, because we have that too, where it's like, hey, this is my anticipation for you. This is what I've seen work. Let's give it a shot. If we need more, then we'll cross that bridge when we get there.
Or
if
less,
you need
too.
less.
What I would wonder
Yeah.
too, like, as a business owner of my own, like if you have a certain amount, you have a nut you have to meet every month, and you're like, well, I did such a great job, or like this particular patient worked out so well that we got him better in 2 days or 2 treatments. My forecast for the month is going to be a little low, right? And that I'm not saying that, but there is that temptation of being like, well, a bad chiropractor would push that along a little further because they have a business they need to run, and that's probably the most evil reason to keep seeing somebody. But I would imagine that would be part of,
And that's rampant
those
across
decisions.
all industries. I would
Absolutely.
assume. Like,
Yeah. You need return business.
I got my nut to hit, so I'm going to prescribe this thing to this person because they're indicated, and we're going to do it.
yeah.
Yeah.
I mean, our chiropractic or doctor's oath is like, first do no harm,
Right.
and I would say the second one is please don't take money aggressively. Yeah, it's a tough one, but I mean, that's the business side of the thing. And I think like we're in a position now where we have less of that pressure, and we're always looking for new patients. And if you want to come in, like, please do, like, we want to help you. But
to that point, because we give honest, realistic expectations and we go over goals with every patient, they have a better patient experience. So like people come in just to come in, they get tuned up and whatnot, but they enjoy like our
essence.
per se. So
I like your essence. I can soak it in when I come.
But I mean, it's like the vibe of the clinic, and you come in
Totally.
and you're like, oh,
Yeah.
this is a comfy place. Like we had someone came in who hasn't been here in a while, and they're like, oh my gosh, it looks so good in here.
Yeah.
Like, I just want to hang out and read the magazines. I'm like, yeah.
do it. There's coffee over there.
I saw somebody just watering your plants the other day.
Yes, they take care of us.
That's fantastic.
So great.
I think we talked about this before too, but like a powerful thing in this industry as chiropractors is like the frequency of visits is sometimes a benefit because we can teach people different things each time they come in. It's not taking up a bunch of people's time. If you can build someone's locus of control and like handling their symptom or their, current physical situation, like I really see a ton of value in that. As a personal trainer, like I saw people develop as like humans who understood their bodies more.
Right.
Like if you're listening, Frank, you met Frank, you haven't met Frank, but he was my first personal training client at Lifetime. And like the first visit I saw with him, like I had this whole game plan. I was ready to go. I'm like, oh, we're going to do this workout. And the first thing I did is like, okay, let's get on the floor. We're going to do some mobility work. He had to like fall down to get there. I'm like,
Oh boy.
well, this is not gonna, that was like the first like,
Rethink this.
yeah. So I was like, we got to do a whole different schema. And I think that translates to my chiro side of things. Cause like you have intentions with people and you want like, here's the game plan. But patient that came in today, she's like, God, my neck hurts and I'm having headaches. That was like, she had mid back stuff going on. We started working on her recently. And I kind of look back and I'm like, well, how have you been feeling? She's like, I had a couple of really good days and I have some bad days. I'm like, great, let's keep working on you. Like, that's the whole point. And she's like, worried about some things, which we were going to talk about today. Like, oh, am I having a stroke? Well, probably not.
Yeah.
So, I mean, we can pivot right into that.
I thought that was really interesting.
That's
you
a
talking
good,
about that. Yeah.
good pivot point. Let's talk about stroke a little bit. And it kind of carries into the mutual patient that we had of like, I promised that I wouldn't get my neck adjusted. You're like, well,
You have neck pain and headaches.
yeah. It's like, yes. So I'll let you kind of touch on it.
Yeah. I mean, so like,
Give us a place to start.
yeah, place to start. What, like when people are talking about, well, I heard chiropractors can, cause strokes. Okay. Sure, that's happened in the world before, but statistically, like, what are the numbers? Like the first few studies that you'll pull up are basically like single case studies of this person had a stroke after getting adjusted. Well, is that like
causative?
Is it a fair way to assess us as an industry?
Right.
No, and you can't isolate like through the studies, like study types, like a double-blind control study. You're never going to get that in the chiropractic industry. You're never going to get that in massage, PT, acu.
So it'd be more observational.
Yeah, it's observational. You
and-
take big data sets over time and you go, okay, here's all the people who had strokes. Here's who went and saw a chiropractor within certain time frames. And there are studies that show this. And so like those data, those research reviews, which is the best thing you can do with this type of industry, this type of therapy, is you look at a correlation, not causation. So there's no correlation from getting a chiro adjustment and having a stroke. There's data out there that suggests like whoever's having a stroke, if you see a chiropractor first or if you see a medical doctor first, those rates are statistically the same. They're not different at all.
Right.
And there's actually more evidence to show that.
Well, and to that point, like, what are some of the symptoms of a stroke?
Oh yeah,
Neck pain,
yeah.
headache.
Oh, jeez.
You know, like,
The first and worst. That's what we learn in school.
yes. So, like, first headache,
Ever.
like this. You know, so that's one of the, questions like, hey, you have a headache. Have you had a headache like this before? And if they're like, no, I've never had one this bad like this before,
Right.
you're like, let's go somewhere.
I taste
Like,
I taste pennies for
Yeah.
the first time.
Methinks
Is that-
this might not be the
but
right day
the,
for
the
us.
point is, like, that's probably the most common, and I don't know,
Yeah.
like neck pain, headaches.
Yeah.
Those are the
Right.
only two indicators of like a VB, vertebral basilar artery dissection.
Well, that's good.
Yeah.
Good job.
Did you learn that in
VBAs.
second grade too?
Yeah.
Yeah, second grade.
Yes. Thanks, Miss Larson.
That was sixth grade. But those like the predictors for that, like the spontaneous dissections of that. So like this guy right in here. Can you see that in the
We
shot?
can see it.
So,
I'll
like-
zoom in on it.
Yeah, the artery goes up through these little holes here, and it takes a little angle and then goes back up. There's actually some anatomy that, like, if you saw it on an X-ray, you'd be like, yeah, if you're old and you have some neck stuff, we'd probably adjust this area differently. But like in general, this is what they're talking about,
Sure.
because this stuff goes up into your brainstem. So if you happen to injure that area, it's not good.
Right.
But the data suggests that they've done like some cool studies. I should have those studies pulled out, but they do like full range of motion challenges, and they look at the tensile strain on this vessel, and like stretching it and holding it into that position is actually worse than a quick light adjustment. So if you have someone doing like a big massage movement, they're doing like some ART and they're stretching that tissue, like that is actually more of a challenge for that specific structure than a chiropractic adjustment.
Sure.
There's another data point I looked at. The amount of adjustments that it would take to like create strain on this tissue is in like the 10,000. Like they looked at like cadaver, like they stretched it like that, and it started breaking down in like the upper thousands.
Jeez.
So
Yeah.
I mean, this is pretty resilient tissue.
That's interesting. I don't think I ever knew that.
Yeah,
And it's a cadaver too, so it's not live tissue.
Dead tissue.
So it's the elasticity's got to be different too.
Oh, right.
Right. So
But
the predictors for strokes like that are so crappy. So as clinicians, it's like worst and first, like we're not touching you.
Right.
And there's people that would be like, okay, well, let's work on you either way.
yeah,
And I think they come from a good place, like let's get you feeling better. But there is a moment to pause and
yeah. There's
Good things.
screenings.
Yeah.
There's screenings that we'll do if people have those certain signs. Changes in vision, hearing,
Yeah,
like
if you-
other things too that we can analyze once they give us those data points. But
Right.
my point being is like, what's the most common reason people come to see chiropractors?
My neck hurts.
Headaches, same stuff. And whether they go see a chiropractor or a medical doctor, like that's just they're already experiencing
Right.
the stroke. It's just depending who they go see,
and some of the studies
who's
that
gonna fall into.
some of the retrospective studies that look at past data, they'll have a questionnaire. It's like, did you have a chiropractic adjustment on the day that you had the stroke, a week, a month, or ever in your life? And so some of the data points they'll take, like, oh, this person went to a chiropractor in their life and they had a stroke. That
Yeah.
equals.
Right.
So that's really unfair. Some of the stuff I pulled up a couple and I was like angry. I haven't looked at this stuff. I wrote in undergrad, I wrote an essay about like why you should go see a chiropractor. It was like a argumentative. There's a better word for it, but it was like a persuasive essay. And I said, you should go see a chiropractor first. And my teacher who was grading it, she was so against chiropractors. So it was like bringing up some of those memories because she'd be like, what's chiropractics? I'm like, you don't know? She's like, I'd heard they hurt you. I'm like, oh boy.
Yeah. Well, I mean, you're gonna believe what you want to believe, and you're gonna then therefore back up that with whatever you can find on the internet to back up your own bias. And there's like very little that someone else can do to change your mind, whether that be a chiropractic or a political stance or whatever it might be, right?
Yeah.
So it's like
I usually say follow the money.
Well, you were talking earlier. You both were talking about the cost of a visit as versus what it would cost to have the end result, the possible end result of a surgery, right?
Yeah, financial end result, and then also morbidity rates per those treatments too.
Right. You can't spend money if you're dead. So that's something I always think about. But then if you really start talking about it, you're thinking about that one.
I was like, can I spend money after I'm dead?
I mean, your
I?
family could. All the money that I'm not going to leave them. But yeah, like it's not even in the same category if you start breaking it down. Like, it's going to cost me, boy, can I afford $500, over the next 4 or 5 months? Boy, I probably can if I think about the other option, which is a $30,000 knee surgery in 5 years, whatever it might be.
Yeah, like a lumbar surgery, you're looking at 50 to 75 grand.
Yeah.
I mean,
50
granted,
to
like
75.
the majority of that cost is through your insurance. Like, thank you, insurance companies, for providing that type of care.
Yeah.
It was just like a heart surgery or anything like that. Like the oh shit like moments in your life, like you're gonna mostly be covered, but like patient out-of-pocket expenses, like we usually run into people with their deductibles being anywhere from like $1,000 to $5,000. We're like, we're probably not going to even get close to that.
Yeah.
Low number.
Right.
Like I was going to pull up our case average, but I know like what it is.
Yeah, you have a ballpark.
Yeah. Like for acute, like what we're submitting to insurance, which they define as like acute care, like we're trying to fix a symptom. This doesn't take into account wellness care for people who want to maintain where they are. We're around like 6.3 to 8.5, I would say.
And just so people understand what that number means, it means the per visits, the visits
per case. Right. So if Zach walked in with hip low back pain as a new patient, I'd be like, let's see you 8 times, but people generally get better before that. So our range is, let's say 6 to 8.
It's like the average.
So multiply that by, generally industry chiro adjustments, $50 to $75. Let's max it out to $100. Yeah. Like most people, like maxing out of pocket expense is $500 to $800 for acute care. And what that translates to, if you have a copay or coinsurance, it's much less. So it's
kind of a no-brainer.
It's a good place to start.
Yeah.
I think is like our clinical education too. Some people are like, oh, like you guys don't go to school as much as medical doctors. Well, we basically do. Like over 4,000 class hours are recorded for medical doctors. We're right around there too.
I mean, I have an uncle who thought it was like a weekend course that I took.
So, I mean, you can look at all those things too. And I mean, we both know how much it costs to become a chiropractor. It costs some money.
Yeah.
More than our insurance. Our malpractice.
You know what? That's actually a sickening statistic.
Yeah, it is. I'm like, oh, kind of depressed now. Like, depends what your definition of a doctor is, right? Like, can I prescribe you medication? No.
It's not in our scope.
That's it.
Thank God.
Yeah, there's a lot of stuff that we know. Like, we just stay within our lane. Like, if you got a musculoskeletal condition, come on in.
Yeah. Like when patients that come and they're like, well, I need to see a spinal doctor. I'm like,
yeah. What do you think I'm doing?
what is this model here? Oh, wait, it's
what do you
Do you have one of these inside of you? Because if you do,
Oh, man. But I think people are, they hear stuff on, media sources and they hear kind of crappy stories.
Right.
Quacker practice.
Like, it's like, I don't know, we just like to help people.
Yeah.
Like, we just happen to have our doctorate.
Yeah.
And we can legally do it. It's kind of cool.
Yeah. I mean,
But like you're kind of talking about medications too, and we were touching on stroke too. Like, your increased likelihood of stroke just from taking NSAIDs. Like think like NSAIDs, ibuprofen, Tylenol, like stuff like that people just take like Skittles. Yeah, nonstop. And it's like, well, if you like, you're putting yourself at higher risk from doing that and not seeing a chiropractor than you are like going to see a chiropractor and actually getting it fixed. You know, it's.
Don't get us started on the opioid crisis.
Please do.
Jeez. Well,
Opioids are bad.
You hear
Okay.
that big farm?
don't do opioids.
I read a little stat, like there's 14 to 25% of people who like are prescribed an opioid will abuse it in some way, like unintentionally or intentionally. Like that is nuts.
It's, I mean, yeah, that's just crazy. It's sad.
And like some of the studies and like the payouts that these pharmaceutical companies, like, oh yeah, there was like 60,000 people that may have died because of this medication, and they paid, you know, a couple $1 billion out of their $13 billion profit. It's like, and then we get greased up for, you know, oh, I heard that chiropractors cause strokes.
Yeah.
That's something you did here, isn't it?
Yeah. Well,
know,
even
5
on,
million,
yeah.
Juxtapose those positions.
You get into like the research behind some like medication research, you know, how they construe numbers, like different medications, they'll be like 60, you have like 66% improvement of symptoms. And it's like, they take 3 people and
They all get diarrhea as well.
yeah, like it's such a small population. It's just like how you can construe the
Boy,
data
my knees
points,
feel
and
great,
it's
but
like,
I have to
Yeah.
sit on the
I have-
toilet a lot. Is it normal for anal bleeding associated with chiropractic adjustments? Like those you hear the
Yeah.
commercials on TV and they just list through everything. And you're like,
Laundry list,
wait. What was that?
Yeah,
third
what was that
one
last
there?
one?
Just
I'm
buried it.
bleeding from my eyeballs.
Rectal discharge. I don't want that.
And maybe to pan off that, why chiropractors suck, and you had mentioned it too, is like the pushy nature that sometimes, because, well, man, this kind of encompasses everything. Because yes, we are chiropractors, but there's also like a sales portion to it, because we have to talk.
Have
You know,
to.
we have to tell them like, hey, here's the money. So
Sorry, we have to take your money.
like, but it's like, hey,
Oh,
this is the
man.
game plan. This is what it costs. It's different than sales. It's just like, no, this is just what it is.
Right.
Yeah,
So
I do
the
think
point-
that was a good point. Like the encompassing parts of what we have to do as chiropractors, like those are the sucky parts.
Yeah.
Like the
Right.
adjustment and the technique, like that stuff is cool.
Yeah,
like
I wish I could just do that.
it's safe and
nonstop.
good.
Yeah.
Like the pushiness,
Yeah.
pushiness
Yeah.
is maybe what puts people off. Of like, okay, I'm out of pain, but my chiropractor wants me to keep coming in. He's like,
Right.
telling me I need to come see him for you know
Right.
5 more years,
And
it's
that
like,
can be a huge turnoff.
yeah. And I'm that way too, because usually I'm like, this is from my sister, like, show me the line so that I know what to cross, you know? And it's
Sure.
like, if somebody tells me something to do, I will likely not do it just
Right.
because they told me to do
Human
that.
nature.
Yeah. I'm pissed off when my mechanic says you got to get the oil changed every 5,000 miles.
Right. But it's more of just laying that out and
Yeah.
being like, hey, here are the options. It's your choice.
Right.
Rich, you should probably, you know, my recommendation would be come back every other week, once a month.
Yeah.
You know, it's up to you.
Right.
This is what it costs. Let Mary know.
Yeah. I think it's all comes down to like a true conversation with the patient. Like I had one gal come in, I'm like, what do you want to do here? And she's like, yeah, I just want like a couple adjustments and see what happens. I'm like, great, let's do that.
Yeah,
And
I
she
think-
came in for more.
I think people are like surprised when we tell them that, because they're like, oh,
Cool.
you're not going to like, I don't have to come in for like 3 months.
Right.
Yeah.
One thing that I've experienced and I've heard from other people, I guess you'd call it just patient care or like attention in the actual session, whether it be real quick and snappy and like in and out, you know, 3 minutes later, they didn't even like really assess me. They just looked at me and said, well, I do this for everybody, so I'm going to adjust you the same way. Right. And that, I think I've experienced it. It's terrible. You know, it's, and that you get that with other doctors though too, where they'll go in and like, you didn't even touch me. Like, how do you, like, can you give me some feeling that you care? Right.
It's a-
I'd
I
say
like
it's
this.
worse in other industries than like,
Oh, yeah.
Oh yeah, I would agree.
This
Like
is-
I walked in and they're like, sit down.
Yeah.
What's wrong? I'm like, oh, well, my shoulder. Okay. Boom,
Prednisone.
boom, boom. And then I'm
Yeah.
out. I'm like, well, that
Yeah.
sucked. I'll never see you again.
Yeah.
Yeah. That's a very, I'm glad you brought that up. We can talk about that.
Yeah.
Yeah. So like the Flying 7. Dun, dun, dun.
was
That's what they call it when you do like the same
that's
routine
7
of
things that
adjustments,
you do.
which yeah, I actually just had a conversation with a patient last week on this, and she's like, "Oh, I went to this chiropractor, and it seemed like it was just like quick in and out."
Usually
And-
cheaper than the average cost. You know,
Right.
$29 special.
Get what you pay for.
You do get what you pay for. But I did my assessment on her. I adjusted her, and I made sure I had the conversation. I'm like, "Hey, to be honest, just to preface, like the adjustment itself doesn't take very long.
Right.
Like, just so you know, like it's not going to take very long.
Yeah.
Like, of course, our appointment times. Like, I came from a different clinic that was a little bit faster times, which is great for them. I just found it wasn't for me.
Right. Can I put my hand up?
Yeah.
Like they had efficiencies in place to allow them to be quick
Sure.
and like getting adjusted by him.
What were those?
Huh?
What were those efficiencies?
I mean, you guys had structures in place. You know, like someone takes care of the exam, and that
Yeah,
gets passed along to the doc who's doing the treatments.
Infrastructure,
and like,
right?
right.
Yeah.
And so, I think that it depends on the clinic too. Like some clinics can afford to be quick like that because they got stuff set up. Personally, like I want a little bit more than that, but I actually don't want much more
Sure.
because
Yeah.
there's some clinic,
Correct.
some providers that they take 30 minutes, 45,
Hour.
an hour and a half. I'm like, no,
Yeah.
no. But they're not just doing the adjustment. They're doing other things too. So you got to define like what your treatment style is to patients too.
Yep.
And I would say we are on the quicker side of things.
Yeah, if you were to take an average.
But we refer people out for that other stuff.
Sure.
Because we want to focus on the adjustment because technically we're good at that.
Right.
And I see that being my focus. our
But
focus.
regardless of your style, what I would appreciate it as a patient is that upfront conversation. Like, this is what we do and how we do it. And then everything add on to that might be out or maybe another session or like, well, this is how it's going to go. Just like the expectations of taking 3 minutes and doing that goes a million miles as a patient, in my
Well,
opinion.
even the 15 seconds, because I had another new patient last week that, you know, I go over, we have a conversation. I go over what it is I'm going to be looking for and then check her.
The S word.
Yes. But I
Sassafras?
just kind of showed her like how her hip should function,
Yeah.
how her low back should function. And I didn't even get 10 seconds into that conversation. She's like, "You already taught me more than my last like
Wow.
chiropractic
That's
experience."
awesome.
You know, so it's like, and how long that took me. And you can even do that in between adjustments. And I've done it with you, like with your foot. I showed you my foot model. Like, hey, I'm actually going to adjust this bone right here because it's not moving this way. And how much that changes their
Totally.
experience because it's not like, hey, get on the table, go face down, crack, crack. See you later. See you on Wednesday.
Yep.
See you, you know,
Right.
and it doesn't take much longer.
Right.
But I think that's where people get that different
It's your
experience.
intention.
It's your intention.
Yeah.
Yes.
I want to say one thing about the flying 7 thing. If you just adjust people and get out of the way, they're going to do better. So to defend the flying 7 angle, like sometimes people just need a little physical like improvement. Like let's adjust them lightly in these areas. Can we even decipher like, okay, is this the segment or is this the segment to adjust? And some argue you can't. And I would say there is some validity to that. But like if your intention is to like be as specific as you can and adjust people well, there's, benefit to that in our opinion.
And I wouldn't say, I didn't mean to put a negative connotation on the flying 7 either.
I don't think
it's
you
just
did.
kind of like what it's called.
Yeah.
You know, it's what like it's
quick.
known. And
Yeah.
we have patients that's come in.
McDonald's of
Like,
the chiropractic world.
Think of patients that just literally just want to come in, get adjusted, and
yeah.
be out in 3 minutes.
Get a tune-up.
You know,
Right.
like almost no talking. It's just like, hey, how you doing? Like
Yeah.
that's what they want. That's
Right.
what they prefer, and
Yep.
it's just like, okay,
Yeah.
And it's not, I mean, not that you guys need the defense, but like to defend good chiropractors, it's on you then to be like, okay, this is what you need. This is what you're asking for. Then that's
Yep.
what we'll do.
yeah.
Right.
Yeah, the wellness clinics out there, they're super fun. They have
Yep.
good vibes
Yep.
and people come in because they're feeling good and they want to continue that.
Yep.
And we're kind of like, I would say 60 to 80% of like wellness patients. And then the other is like acute care. Like I tweak something, I feel like crap and I need help.
Yep.
And that's a part of it too. So I think we blend those things well and
Yeah.
convert those acute pain patients into wellness patients and
Right.
have fun.
Okay. Well, that's probably
That
a
was
good
a lot of
time.
good stuff.
That was a lot of good stuff. I didn't realize
I feel
what
like
time
we
it was.
scratched the surface on that too.
We did.
Well, yeah.
Well, great.
Thanks
Dr.
for-
Zach
good
has
combo.
patients chomping at the bit here.
Yeah, got to go give them that
patience,
top
yeah.
grade A
Just-
treatments.
Yeah, just
Yeah,
So thanks for watching.
thanks
thanks for
everybody.
watching.
Yeah.
That's
More
that's
to
a
come
wrap
on
on the tap.
The
Cheers,
Bingo.
buddy.
cheers, doctor.
Thanks, people. People's Organic.
Cheers,
Chiropractor.
boys.
Can't wait for you to be our sponsor.
Wink, wink.
We'll wait for you,
Hey,
but
thanks.
not too long.
Thanks, guys.
See ya.
This is a house of learned doctors. You're not a doctor.
I wish